are shedding the heavy winter clothes, and you know what that means. Cute little skirts, bikini season, and you want to feel good about your body. That's why I'm at Davis Plastic Surgery with Dr. Glenn Davis to talk about CoolSculpting. And this is so cool, a way to get rid of fat without surgery.
Yes, it's quite exciting. Before we had this capability, we only had surgical means to reduce fat. Now this is an FDA-approved, non-surgical, permanent fat reduction in spot areas with virtually no pain, no risk, and very rapid results.
Dr. Davis, let's talk about how it works. And we have a patient model here, and Jenna, your nurse, who's going to guide us through what a patient can expect when he or she comes here to Davis Surgery.
Yes, well, the whole principle is that at a certain point in your life, the number and location of fat cells in your body remains constant. So if you remove some of these fat cells, they're gone. They're out of your body, and the body does not make more fat cells to compensate that. For that's a permanent reduction. So what we do is we cool the fat cells to the point that the lipid or the fat in the cell will crystallize. It breaks the fat cell dies, the body absorbs the fat, and it's a permanent reduction of the fat. We get anywhere from a 20 to 25% reduction in the fat in the area where we cool. It's not technically freezing, but we talk about cooling it just above the freezing point. This is not frostbite, but it's a super cooling of the fat.
Okay, so the patient feels coolness, not cold, but coolness.
Well, it can be cold initially, but most people will tell you that after the first couple of minutes, it's really quite comfortable, and they don't really notice any coldness to the application.
Okay, so tell us what Jenna's holding here and how this works.
She has the application head, and they come in different sizes depending on the part of the body, and that's placed directly on the fat that then is drawn up into the machine between two cooling plates, and these two cooling plates will super cool the fat and cause the fat to crystallize over approximately an hour's time. Each application area is for 1 hour, and that seems to be the optimum time.
Is this something that a patient needs to come in week after week and
No, it's a one application process.
Wow.
Where the results you'll see anywhere from 2 to 4 months. You'll see changes. You can reapply in the same area or different areas, but it's designed as a one-time treatment.
Who is the ideal patient?
Well, anybody who has enough fat that you can literally grab.
Okay.
If there's not enough fat there to be drawn up into the machine, it's not really going to work. But it works very well for people who have particular areas, the typical saddlebag, posterior waist area, the upper abdomen. We have tried it on different areas as well, but those are the areas that usually works best.
What about arms?
We have done some arms, but the applicator is usually a little too big for the arms to be really effective.
Okay.
And of course, everybody hates their arms. We don't have any great option for the arms, but this works on some people's, but it mainly works around the waist. It's where we see the most effective treatments.
And as far as cost, it's not as expensive as liposuction.
Yeah, it's a lot less than at liposuction. You're not involving the cost of an operating room, the cost of anesthesia, and it's, again, non-surgical, so it's a lot more affordable.
And you are the first office in our area to offer this?
I'm the first plastic surgeon in the area to offer this as an option for all the body sculpting options.
I love the story about the popsicles and how this came to be. Can you tell our viewers about that?
Well, back in the 70s, it was noted that kids who were frequently overindulging in popsicles would have thinning of their lips and thinning of their cheeks, and due to the cooling effect of the constant popsicle applications. And it was discovered that the fat was being crystallized and dying, and kids were ending up with thin lips and thin cheeks.
Wow. Thank you, kids.
Yeah. So out of popsicles, we've come to this great technology here.
Okay. Are there any side effects we need to be concerned about?
There are sometimes some temporary uncomfortable feelings, and we don't like to use the word pain because it's not really painful. It's a little uncomfortable, kind of some soreness. That's usually treated very well with just over-the-counter anti-inflammatories.
All right, well, this is really cool,
It
Dr.
is.
Davis. And thanks so much for telling us about
thank
it.
you.
We'll have more details on our website, mycarolinatoday.com.